There are roughly 6,093 hospitals across the country, 84% of which are community hospitals, with a large majority operating as nonprofits. As difficulties with staffing, wages, and inflation continue to impact the industry, many hospitals are struggling to stay afloat and provide necessary services to the communities they serve.
Programs are impacted by federal and state payers. Typically, for Medicare, which is the largest federal payer, hospitals only make somewhere around 80 cents on the dollar. For Medicaid, it's even worse, 67 cents on the dollar. And then with 60% of payers for every hospital, either federal or state payers, that doesn't leave much left to be able to handle the high inflationary costs hospitals are seeing today. Even if a community needs it, the only way to break even is to close programs that are losing money, or else the hospital itself could close.
Between 2010 and 2023, more hospitals closed than opened, raising concerns about access to care. In California, close to 50% of hospitals are operating in the red, losing money on every single patient they care for.
Reimbursement for these services that the hospital have, which are oftentimes very expensive, those diminished payments from insurances, there's no change in terms of things like inflation and the cost of the care. I think technology and innovation have transformed a hospital's ability to improve quality, reduce costs, streamline operations. I think the goal for technology is essentially to integrate it into all aspects of the healthcare system.
As the industry continues to grapple with financial pressures and gaps in community care, developments in technology offer a pathway forward.
We were founded in 1907 by a physician named William Craig. We really pride ourselves on the work that we've done in this community. We have a center of excellence for cancer care. We have a center of excellence for cardiac care, orthopedics, and our women's care. We are reaching out to our high school community and doing internships, both clinical and non-clinical, so they can see what happens in a hospital. And our hope is that they're gonna go on and get that certificate, that degree in healthcare, and that they're gonna come home and practice right here in their backyard.
The nonprofit Acute Care Hospital is leading the way in Southern California by creating means of combining cost efficiencies with cutting-edge technologies, workforce innovation, and custom population health strategies.
We're a lean organization. The idea is to get rid of waste. When we talk about waste, we're talking about operational waste or costs. So we have crash carts that probably has over $150,000 worth of supplies and instruments in it. They may only need, for instance, something to help open an airway. And I'd say 50% of our code blues are that. Yet that whole $150,000 goes out the window. My staff put those airway instruments on top of the crash cart in a separate locked area. They don't open the crash cart, and there's $1 million savings. It's amazing how something small could be done. The Center of Aging was created to solve a huge problem that's hitting San Bernardino and Riverside County. Over 100% growth in terms of increase in population for senior care, needing care management, needing multiple appointments the same day, so they don't have to pay $500 or $600 of transport costs out of pocket. You have all of their providers in there, from primary care to specialty. And down the hall is your imaging suites, your labs, your pharmacies, your PT, your occupational therapy, all in one spot.
With expanded healthcare services to address the needs of the region's growing Medicare-age population, the Center of Aging offers a comprehensive one-stop shop for seniors and their caregivers.
It's not unusual for most of us to have more than one chronic condition by the time you've crossed like 60. As they grow older, they become isolated. This sense of social isolation is the worst thing that we can do for our senior community. Group classes allows us to bring them back into this center, so it's their center. They learn, they meet each other. It's a place for them to sort of socialize and live. One of the things that's happened in the world of medicine is that your primary care doctor and the doctor that takes care of you while you're in the hospital are two separate people. This is not the way it was originally. What used to be, your primary care doctor would come in to take care of you and would, know you and your life story. Now, because it's so vast, it's so different, and there is a real paucity of doctors. We've divided it. Care4U is a way for us to bridge that gap. It gives you a post-discharge visit that ensures that the reason why you were hospitalized is taken care of, that there are no gaps in your care, and that these notes get transmitted to your doctor quite easily. So while we're waiting for technology to catch up, our patients don't suffer in any way.
By filling the gap for those who may not have access to a physician directly following discharge, Care4U centers help patients successfully transition to their home, reducing complications and avoiding unnecessary readmissions.
Some of our other programs, the Da Vinci robot. Robotics solved a problem in surgery with their use of multiple arms to go in through 3 or 4 small holes, looking at a screen, being able to intricately see inside through the use of those arms without having to open the patient.
I think in terms of technology, we need to use the efficiencies that's afforded by technology to essentially be able to spend more time with patients. One of the issues that we have is that we're oftentimes looking at a computer screen rather than looking at the patient. And so technology, by becoming more efficient, allowing that interaction to occur, you're able to spend that time and look directly at that patient and provide the care that they deserve.
Cutting-edge technologies and procedures will continue to improve patient outcomes and remain key factors in moving the industry forward in the future.